Welcome to the Life After Whipple Project. I'm Greg Adams, a stage 4 pancreatic cancer survivor and current team leader. Neuropathy in your hands, and especially in your feet, is a frequent consequence of this cancer journey, but it doesn't necessarily have to be. Tonight, we are going to explore the use of acupuncture for treating or even preventing neuropathy from diabetes or chemotherapy or both. Dr. Ziad Elias is here from Henry Ford Health in Detroit to give us a short course on the history and science behind acupuncture and its use in treating neuropathy.
As Greg mentioned, my name is Ziad Elias. You can call me Z for short if you ever want to reach out. So the intent of this is to introduce you guys to acupuncture in the context of neuropathy, especially within in the oncology setting, with some adjunctive information with respect to diabetic neuropathy as well. So this is going to be a pretty comprehensive presentation. I know a lot of people are not too familiar with acupuncture. There's a lot of misunderstanding and conceptions about acupuncture. So we're going to start kind of broad and whittle down to a little bit more detail, then come back out for some more logistics as it pertains to the acupuncture and the treatment process. So we'll be starting with kind of broad definitions with respect to complementary and alternative medicine, integrative medicine. These are kind of words that are thrown around and used interchangeably, but there are some differences. We'll go into a little bit about acupuncture with respect to its background and history. We'll go into neuropathy, some basics about neuropathy. Some of the research, there's been some good meta-analyses done with respect to acupuncture and neuropathy. We'll go into how acupuncture works. And then we'll end with logistics, in terms of treatment, structures, things like insurance, those kind of things, how to find a properly credentialed acupuncturist. And I'll leave you guys with some resources you can go home with online that you can find. And then I'll end with a demonstration. So many people have not been exposed to acupuncture. I'll be, needling myself here and showing you guys what it looks like and try to alleviate any kind of apprehensions or fears you may have about that. So my name is Zaid Elias. I am an oncology acupuncturist at Henry Ford Health in Detroit, Michigan, with the Center for Integrative Medicine Department. We'll start here with some definitions with respect to complementary, alternative, and integrative medicine. As I kind of mentioned in the introduction here, a lot of these terms are used interchangeably. So I'm going to kind of get these out of the way so you guys can understand the nuance between them. So yeah, you may have heard these various terms: allopathic, biomedical, Eastern, traditional, orthodox, these kind of things, alternative. There are some differences with them. So we're going to start with the foundation of conventional medicine. This is what we're all familiar with, what we all go to our doctors for. So this also is called allopathic medicine, biomedicine, Western, mainstream, orthodox medicine. So this is what MDs and DOs use to treat and manage symptoms using standard or conventional therapy such as medication, surgery, and rehab. In reference to conventional medicine, complementary is a use of non-mainstream therapies together with conventional medicine. These are things like herbs and supplements, chiropractic, massage, acupuncture. These are also considered complementary therapies. Now, alternative is the use of those complementary therapies instead of conventional medicine. This is generally not advised, but although in some parts of the world, this is the standard. What we look at as alternative is actually a standard in some other parts of the world. So now the one distinction we're going to go into now is integrative. So this is the use of complementary therapies that have an evidence base. That's used alongside mainstream medicine. So these are shown to be safe and effective, and it aims to treat the entire person. That's like the mind, body, spirit idea, hence the term integrative medicine. Also, with respect to integrating into the mainstream practice as well. So in brief, very quickly, quick summary, conventional medicine refers to the standard. Complementary is together with, alternative instead of, integrative is together with evidence. So those are some very quick definitions and the differences between those terms you may hear being thrown around. Now, the NIH have several branches with respect to the study of research of health and medicine. In 1999, they actually established a Center for Complementary Integrative Medicine. So there was enough interest and research going on to establish this department. So part of their efforts were to look at the utilization of these various therapies. So what they found, when they looked at these various therapies, which you can see a list over here, ranging from acupuncture, Ayurveda, various kind of breathing exercises and meditations, yoga, we're very familiar with, they find a pretty consistent trend of about 1/3 of US adults utilize these therapies. On the right side, you'll see that among those therapies listed, these 5 categories have been shown to have an increase in usage over that time. There was another study done a little bit later, but it focused only on yoga and chiropractic. Yoga continues to have an increased interest in utilization. But over this time period, as illustrated here, these 5 categories had shown an increase in usage. Acupuncture is one of them. Now, among cancer patients worldwide, CAM therapies, complementary alternative medicine therapies, are used quite frequently. And this is a study looking at 18 Western countries, and prevalence is about 40% usage of these complementary therapies. The US had the highest utilization of about 50%, and it's anticipated to kind of increase over time as well. Now, there is no small amount of money being spent on these therapies. We look at physician visits, conventional physician visits, nearly 50 billion, compared to complementary, 15 billion nearly. Prescription drugs, 54 billion versus nearly 13 billion for natural products. That includes herbs and supplements and various kinds of vitamins and minerals. Now, what's interesting also is that despite differences in income, the amount of money is still being spent is a decent chunk, ranging between $400 to $600 per year. So now, to kind of tie this knot with respect to this kind of introduction to these therapies or these kind of categories, the NIH defines integrative medicine as an approach to medical care that recognizes the benefit of combining conventional with complementary therapies that are shown to be safe and effective to address the whole person's health and well-being. More specific to oncology and kind of a bit more relevant to our discussion here, the Society for Integrative Oncology defines integrative oncology as a patient-centered, evidence-informed field of cancer that utilizes mind and body practices alongside conventional cancer treatments to optimize health, quality of life, and clinical outcomes across the entire cancer care continuum. That is from diagnosis all the way through survival. You can see on this kind of pyramid on the right, the foundation, of course, again, as I reiterate, is an evidence base. So that's very, very important. And I mentioned this because cancer patients disproportionately utilize complementary therapies, and unfortunately, a lot of them don't tell their physicians, and may not be utilizing it with the proper guidance as well. So we want to emphasize safety, so and that's why I kind of mentioned the evidence base is very, very important. Okay, a little bit about acupuncture with respect to background and history. So acupuncture, what is it? It's a medical procedure involving the insertion and manipulation of a solid monofilament, sometimes called a filiform needle, into the body for a therapeutic purpose. Now, there's a little bit of confusion with respect to acupuncture and associated modalities or terms. There have been a lot of terms thrown around that sound like it, but are trying to be presented as something distinct when they're not. So you may have heard of terms such as dry needling, intramuscular therapy. There are also terms that look at acupuncture in terms of style, such as based on country. There's Chinese style, Japanese style, Korean style. So these are all actually forms of acupuncture. Unfortunately, with some of these terms you may hear, such as dry needling or intramuscular therapy, these are attempts to circumvent the training of an acupuncturist by rebranding it as something else. So there have been several attempts to do this. There has been successful attempts in getting legislation where people are practicing with just weekend courses, for instance. So unfortunately, that's the case. So you want to make sure that you have somebody who's properly trained. You just go back to that original definition I mentioned. If it uses a monofilament or a filiform needle inserted into the body for a therapeutic purpose, it is acupuncture, no questions asked. So I want to clarify that. Now, acupuncture is one branch of what is called Chinese medicine. Chinese medicine is a whole system of medicine. Acupuncture is a significant branch of it. So it includes also herbal or botanical medicine, nutrition, exercise. That includes things such as Qigong, which is a breathing practice, or Tai Chi. It also includes manual therapy. So That includes medical massage, manipulation, cupping, which has gained a lot of traction or attention, especially among athletes, and then dermal friction, or we call gua sha in Chinese. So it's a very complete system of medicine. Acupuncture is just one important branch of it. Now, this also adds more confusion. There are various terms to describe the overarching or the umbrella of the medicine there. You may hear Chinese medicine, traditional Chinese medicine, classical, Oriental, East Asian. We have a bit of an identity crisis here in the United States. There's actually a bit of a migration away maybe from these geographical terms, but you may also just simply hear it be called acupuncture and assume that the acupuncturist incorporates these other modalities as well. So if you do hear these terms, they all essentially refer to the same thing. Okay, now we don't know exactly how acupuncture got started. So this cartoon, as funny as it may be, is not too far off potentially. So there are some stories that say, supposedly a soldier that had some shoulder pain in the battlefield, he took a spear to the leg and the shoulder pain went away. That's one story. The idea that illness or disease or pain or these kind of things are caused by evil spirits, which is not unique to China or other parts of East Asia, is kind of a idea that's been kind of passed through time in different parts of the world, and that you chase it out with a needle, for instance. That's one theory. One of the other theories, which is very reasonable, is that you have this kind of inclination. For instance, say if you bang your knee against a table, the first thing you may do is rub your knee, right? So that's an observation that was made. Say, hey, why do everybody seem to, as soon as they bang something, they kind of rub their knee? That's kind of a natural instinct. Well, what's the extension of that? Maybe put more pressure. What's the extension of that? Maybe get an object to add even more pressure. What's the extension of that? Let's insert something and see what happens. Is it one of these things? Is it all these things? We don't really know. But this cartoon may not be too far off as far as one of the influences as to how acupuncture started. So the earliest records of acupuncture to what resembles what we have today goes back a little over 2,000 years. The practice of needle therapy that predates kind of the theory of acupuncture in Chinese medicine goes back even farther. They used to use sharpened bamboo or stones or bones for needle therapy. But something that resembles close to what we do now goes back roughly about 2,000 years and was found in the tomb of this prince. Okay, now how did acupuncture come to what we know as its current incarnation? Like many practices or arts, it was initially taught in a kind of teacher-apprentice kind of structure, passed down, in a lineage. It wasn't until the 50s that Mao Zedong decided to bring together a committee to organize Chinese medicine and actually institutionalize it. So in 1954, the first 5 colleges of traditional Chinese medicine were established. This was done for a couple reasons. This was used to help address the shortage of medical providers, especially as Western medicine was emerging. There wasn't enough of that, but also there's a political element too, where he saw this encroachment of Western medicine onto Chinese culture, and he thought of it a bit of a threat on their values and identity, and so he established these medical schools of Chinese medicine as a kind of a reaction to that as well. So both practical and political reasons or the impetus for the establishment of these colleges. Now, in terms of how it came to the consciousness in the United States, believe it or not, this gentleman here was the catalyst for that, or a big part of it. James Reston was a reporter for the New York Times. He was traveling to China ahead of Henry Kissinger, but while he got to China, or when he got there rather, he got appendicitis. So he was hospitalized. He had surgery. And then for post-operative pain management, instead of receiving medication, they had an acupuncturist go up to his room and treat him. So he had a positive result from that and came back and wrote about it in the New York Times. So about appendectomy and then this post-operative process there. So he told Kissinger about the experience, who told Richard Nixon. And from there, it kind of catalyzed this exchange of ideas between China and the US. And so also around this time in New York City, the Young Lords of Black Panthers, a couple of political groups, took over the Lincoln Detox Center and established a drug program for rehabilitation in response to the heroin epidemic and drug epidemic they had there. So a gentleman by the name of Matulu Shakur based on his experience that he had with his kids who were involved in a car accident and received acupuncture, suggested, hey, how about acupuncture as part of our rehab facility? And then that started the first acupuncture detox program in the United States. And that program, or at least the elements of that and the protocol, still exists today in over 2,000 centers across the world. So Dr. Matula Shakur, along with Dr. Smith, who helped develop the protocol, were the big contributors to that. A little side note, that last name Shakur may look familiar. That is actually the stepfather of the late rapper Tupac Shakur, believe it or not. So Dr. Shakur went on to study acupuncture eventually and got his and started practicing it. So those events eventually led, and the exchange, of course, of ideas between the Chinese physicians and Western physicians led to the development and establishment of the first acupuncture school in the United States in Boston. So that is the New England School of Acupuncture. This since has merged with the Massachusetts School of Pharmacy, I believe, in 2016. So that's where it's at right now in terms of acupuncture as it's practiced in the US. Now, a little bit about pancreatic cancer, of course, which we'll just go to brief stats. I'm not going to bore you with that. I'm sure you guys are very, very familiar about diabetes and neuropathy. Prevalence of pancreatic cancer. We have a total of about over 100,000 people with pancreatic cancer. In 2024, they estimate about a total of 66,000 patients that will be developing a pancreatic cancer, diagnosed with it. Now, approximately 43% of those patients, pancreatic cancer patients, will be receiving chemotherapy. And this is kind of where we're going to get to the crux of our presentation here. So, unfortunately, many of the agents utilized in pancreatic cancer have toxic elements to it in terms of with respect to neuropathy. On the left side, you see these are the main groups of drugs used in an oncology setting that have neurotoxicity. And a number of these, namely your platinum-based medications, your taxanes, your antimetabolites, excuse me, have those effects, and those are all used in the pancreatic cancer settings. As you can see on the right, those are the compounds that are used. So now, what is neuropathy? Simply, in this very rudimentary sense, is the disease of the nervous system. But as we talk about it more in the context of the clinic, in terms of oncology, it broadly refers to peripheral nerve damage as a consequence of antineoplastic agents. Very common side effect, as I kind of mentioned, is a cancer treatment limiter. If the neuropathy advances too far, treatment can be stopped, or doses can be reduced, which will not optimize the benefits, right? And it significantly affects quality of life. Now, some people or some patients I have, they assume that neuropathy refers to simply just numbness or tingling. Neuropathy encompasses a wide variety of symptoms, so that can be numbness and tingling, of course. That's sharpness, that's stabbing, various temperature changes, from cold to hot, or burning rather, throbbing, hypersensitivity. These are all symptoms of neuropathy. Most common is sensory, as I just described. There are motor and then autonomic neuropathies as well. So I have many patients coming in and they're very concerned because they assume that the neuropathy is just going to be numbness, but they're experiencing these other sensations as well. So they, as I mentioned in this list here, but they also describe things as their feet feeling heavy, they're walking on gravel, there's a lot of pressure. These are all also parts of neuropathy, it's symptoms of neuropathy. So it's not just numbness and tingling. It can encompass a wide range of paresthesias. So now I'm going to bring in diabetes here, and I'll explain why it's important in the context of oncology here. So the CDC recognizes there's over 38 cases of diabetes in the United States. And over time, at least 50% of individuals with diabetes develop diabetic neuropathy, a pretty significant chunk. Depending on the source, it will range, depending if you're just looking at new onset versus a whole spectrum, But what they find is, especially with age, as it increases, especially get over 60, 65, incidence increases. So why this is important? Because there's a link between pancreatic cancer and diabetes. It's a bit of a chicken or egg, but we find that patients with pancreatic cancer Many of them have a history of diabetes. In the one study here, we have about 38%. Another one shows about 45%. And that's important because this can make the neuropathy much more difficult to treat and increases the risk, of developing chemotherapy-induced neuropathy if you already have diabetic neuropathy or diabetes. Now, one thing I cannot emphasize enough is the impact that neuropathy has on quality of life. Um, you know, uh, I think we take for granted our sense of feeling because we're, of course, unconsciously using it all the time. And this has been expressed to me many times by several patients where how much it impacts their day-to-day living. Everything from their physical state to mental state. Many patients express that they are afraid to engage in social activities in fear of falling, stumbling. Some people have told me they feel like they look like they're drunk when they're walking. They are afraid of how they may be viewed. Some patients don't want to divulge that they are have been diagnosed with cancer or undergoing cancer treatment. There is, of course, risk of injury. They're dropping objects, they can fall. Actually, patients with neuropathy have a higher uh, medical expenses because of that. So that's been shown as well. So there are several elements in terms of quality of life that are impacted by just losing your sense of feeling, and with the pain and paresthesias associated with neuropathy. Of course, they cannot engage in their activities that they enjoy doing. I have many patients that are into, for instance, motorcycle maintenance or going hunting or have certain hobbies that are prevented from participating in because of the neuropathy. So there's a bit of a snowball effect here when it comes to it. Now, we have this problem that is very hard to address. And in the conventional side of things, there is not really any great options, to be honest. So the Journal of Clinical Oncology discussed, that really there are no agents recommended for the prevention of chemotherapy-induced peripheral neuropathy. Duloxetine is the only agent that has some evidence. There has been more data since, a little bit since, but that's kind of the main agent they recommend alongside gabapentin, and then you have your Cymbalta, Lyrica, and gabapentin are the big ones or first line that are commonly used. So similarly, the American Diabetes Association prevention, this would not come as any surprise. For diabetic neuropathies, focus on glucose control and lifestyle modifications. For established neuropathies, again, your Lyrica, Cymbalta, gabapentin are going to be the ones that are used for as a first line of primary intervention. And to clarify, these are used to help manage the pain that's associated with neuropathy. Is not used to help restore function or feeling. So in either case, whether it's chemotherapy or diabetic related neuropathy. So now there are some suspected risk factors, and I kind of alluded to already with diabetes. These are not conclusive. This is still being kind of sorted out here, but the first three seem to have the most consistent evidence behind it. Again, not anything conclusive, but pre-existing neuropathy, that can be either diabetic, that can be idiopathic, so which is of unknown origin. So if you have a pre-existing neuropathy, you are more likely to develop chemotherapy-induced neuropathy, and it'll be much more difficult to treat. So age, the older you are, the more likely you can develop it. And there seems to be some genetic components as well. There are other elements, deficiencies of certain vitamins, namely B vitamins, diabetes, not necessarily diabetic neuropathy. If you just have diabetes, even without neuropathy, you may be at higher risk as well. Obesity, kidney disease, smoking and alcohol, and then HIV, hepatitis, and thyroid disorders. I should make a mention here. I know patients often, with respect to supplementation, take vitamin B in hopes that it will help. There has been some data suggest that it may help with some prevention, but really, if you're already deficient in it, it may have some benefit. But other than that, it doesn't need to be helpful at all. Okay, so conventional treatments, as I kind of mentioned earlier, for neuropathy, again, the big one's going to be Lyrica, Cymbalta, gabapentin. Other drugs that are used, tricyclic antidepressants, that's kind of like a second line. Sometimes topicals are used, lidocaine, capsaicin, or some compounds, custom compounds as well. If there's a lot of pain, NSAIDs and opioids are used. But again, these are also, just to reiterate, to treat painful neuropathy. It's not to get feeling back. Now, common non-pharmacological treatments for neuropathy: acupuncture, massage, physical therapy, meditation and mindfulness, and exercise. And of course, we'll be focusing on acupuncture here. Among these therapies, acupuncture has the most research with respect to neuropathy. Now we'll go into a little bit of the research here. Now, for a while, they didn't have enough studies to compile a meta-analysis. So a meta-analysis is kind of the gold standard in terms of research. It compiles various randomized controlled trials and increases the robustness and the power of this, basically of the data. So if we can get more, records incorporated into an analysis, assuming that they are similar enough, you can have more reassurance that some of the data coming out of it is stronger. So, this actually looked at various neuropathies. So primarily, it looked at studies between 2004 and 2013. 15 studies, over 700 patients were included into this review here. So what I found, or what looked at, was neuropathy caused primarily by diabetes, Bell's palsy, carpal tunnel syndrome, HIV, and idiopathic neuropathy. Now, this is one of the early analyses done. Actually, the citation there is wrong, so sorry about that. So what I found was that acupuncture is beneficial in some peripheral neuropathies, suggested to be beneficial for diabetic at the time, Bell's palsy, and CTS. But more studies were needed, to really make some better conclusions about it. So we moved forward a little bit. This done by a leading company, looked at effects of acupuncture therapy and diabetic neuropathic pain, a review and analysis here. And this had a more robust, base here. So looking at studies between 2014 and 2023, 19 randomized controlled trials, over 1,200 patients. What we found here is that acupuncture therapy alone or in conjunction with other therapies prove to be superior to controls. Controls can range from sham acupuncture, which is basically fake acupuncture, standard of care, weightless controls. These are all considered kind of controls in these situations. And they found clinically significant reductions in pain intensity and improvements in quality of life as well. So that's kind of the interesting thing about acupuncture, is that it can help address clusters of symptoms. So even though a patient may be coming in for neuropathy, other symptoms can be addressed. For instance, many patients come in for neuropathy and they feel they have less stress, they sleep better, they have less pain, not even just related to neuropathy, but cancer-related pain, say to the malignancy as well. So that's kind of the nice thing about acupuncture, is that it can help tackle a few things at one time. Also, what's very, very important to note here is that the safety profile of acupuncture is very, very good. So very few instances of significant adverse events and no instances of serious adverse events. So significant events, they even consider a bruising or a little bit of bleeding as significant, so that's really not a big deal in the clinical setting. But as I mentioned, very, very high safety profile. Now, looking now from diabetes to a meta-analysis on chemotherapy-induced neuropathy. Again, a large number of patients involved in this. Studies between 2008 and 19 randomized controlled trials, over 1,000 patients. Very similar results. So you have overall effectiveness to be superior to that of drugs, recovery of sensory function better than motor function. That certainly bears out to be true in my practice as well. And sensory function, or sensory deficits, is the most common type of neuropathy that we find with these patients. So many non-chemotherapy-induced peripheral neuropathy symptoms, such as nausea, appetite changes, drowsiness, also improved. Fatigue, these kind of things also improved. Going back to what I mentioned earlier about the ability to address clusters of symptoms and improve quality of life. The only caveat is that with neuropathy, the recovery course is long. Even with the aid of treatment with acupuncture, the recovery course is long. I tell folks, and the data shows that most of the recovery with neuropathy, even untreated, is going to happen within the first year, 6 months to a year. It's going to be the kind of the bulk of the recovery of the neuropathy. That's after completion of the chemotherapy. So with the aid of acupuncture, you can expedite that a little bit. It's not going to be such a big hack where you're going to increase the recovery threefold or something like that. That's not the case. But what it can do is help keep the ball rolling, keep encouraging circulation to the areas, oxygenation, stimulation of the nerves to keep them engaged. So what can be very frustrating for the patient is that they may not see any changes for several treatments, so even up to 8 to 10 treatments, they may not see any changes, so it's a bit of a marathon. I tell patients, not so much of a sprint. You have to kind of be patient with it. Also, the recovery course is not like a linear recovery. So you may have kind of ups and downs over the course of the neuropathy recovery process. So, and some of these symptoms people may experience as nerves are recovering can be uncomfortable and can be a bit, similar to what they experience as they develop the neuropathy. They may experience interesting tinglings. They may experience shooting sensations or aching or itching or these kind of things. And it may give the impression that things are getting worse, but it's actually those nerve endings recovering and growing. Not too dissimilar to what a patient may experience after, say, a surgery. So if they have nerves cut in the process of surgery for a long time, it's quite numb. As those nerve endings grow and recover, they may experience some different sensations as those nerves are trying to fire and to figure themselves out. So just to emphasize, the process is long. You got to stick with it. And if you look at patients that have a course of acupuncture and you look at them a year later versus a group of patients that do not receive acupuncture, the former makes more gains. So now, how does acupuncture work? So these are some very interesting diagrams you may have come across online if you ever Google acupuncture. The left is more of a kind of a modern diagram. The right's a very old, I think 17th century representation of a particular acupuncture channel. So you may have heard terms such as points or acupoints. You may have heard terms as channels or meridians. What ties us all together is this idea of chi, this concept called chi, as you see pronounced over there. Now, chi oftentimes, you may hear it even in kind of, pop culture. You hear it as energy, right? So it's even permeated into our day-to-day living. I don't even know if they have this beverage anymore. There used to be a chi beverage. You may have a charger, a Samsung charger or a phone charger that is chi certified, and even in movies and video games, you hear about chi. The thing is, as popular as this concept is, that chi is not quite energy, so it's a very convenient, but it's an oversimplified translation of it. And unfortunately lends itself to very much kind of this new age metaphysical kind of thinking, and it may alienate a lot of people. The reality is that when I studied in grad school, chi was never translated as energy. It was just left as chi. When I studied in China, it was never translated as energy. It was just left as chi. It's one of those terms that does not really have a clear translation for it. Now, and Dr. Unshold, the world's probably foremost expert when it comes to translation of ancient Chinese medical texts into English, goes on to say chi is one of the very few Chinese terms we have chosen to transliterate rather than translate. It should be noted that the translation of chi as energy, so widespread today, lacks any historical basis. And he comes from a different perspective. He's an academic, not a clinician. So he's not invested in this in the same way that maybe one of us might be, so he's looking at it very objectively. And I mention this because, I feel, and it's been expressed to me by some patients that it kind of turns people off, right? Or may alienate them or may conflict with some of their own beliefs or values. So I'm just here to say, to reassure that it does not, and there are some misunderstandings around it. And the misunderstandings come from, unfortunately, from this gentleman here who was well-intentioned, George Sully du Morant. It was a French diplomat in China during the cholera epidemic. So when he witnessed the benefits of acupuncture during that time period, he decided to study acupuncture and Chinese medicine. And over that time, when he was studying it, he came across the term chi and tried to translate it, into French initially. and for lack of a better term, called it energy based on his studies of also Ayurveda time, and I think conflating it with prana or other similar practices and theories. So unfortunately, this idea of chi as energy continued to permeate in a very oversimplified way. So what is chi? There's not really a clear translation for it, as I mentioned, because Chinese is a very contextual language. It's very, very different than English or similar languages that we have. These characters, they're almost like pictographic representations. They don't represent a single thing necessarily. So for instance, we have this character called Zhang, which refers to talk or speech or speak. And you have this character Tai, which refers to some kind of platform or stage or a terrace. You put these characters together and it refers to a lecture platform, you know. But you also need to contextualize it further to identify, well, is this a pulpit? Is it a lectern? Is it a podium? So by adding other characters around these two characters, you can further deduce what's being talked about. So you can imagine when you have this medical theory or concept of chi and how complicated it might get, So it's a very dynamic idea and medical philosophy, and it can kind of change depending on the context of what is being talked about. So just to kind of clarify so chi is not just simply energy. There's more to it than that. There have been attempts to identify it as things such as ATP, which is not bad, but it doesn't quite capture it all, or the ensemble of function of the whole body, or potential for capacity to change. So the reality is that we can't really translate it. We just have to try to understand it, within the context of Chinese medicine and philosophy. And that makes sense because you have the development of this medicine at a time period where they didn't have the resources we have now. Had they had those resources, maybe it would have been different, so we'll just leave it as chi. Now, early theories of acupuncture, of how it works. You have this solid monofilament needle that has no medication on it. So how on earth does it work? Early theories refer to the endorphin release, which still stands today. You have the pain gate theory that still stands today, and you have placebo. Totally reasonable suggestion. As I mentioned, you have this needle with no medication on it. How could it possibly work? We now know with research that it's not just placebo. Does it benefit from placebo? Yes, it does. All medicine benefits from placebo. That is the patient-practitioner relationship, and that is very, very important. I should go on to mention actually a very interesting study done by Ted Kapchuk at Harvard back in, I think, 2010. It was published, looked at IBS sufferers. They had two groups of people. They had one that was basically waiting, and you had another group that was given an open placebo. They were told you are receiving a placebo, and they went on their appointments as scheduled. And that group that received the open placebo, that were told that you have this placebo, still got twice as much symptom relief. So placebo is to our benefit, so that is the patient-practitioner relationship. So all medicine benefits from it, acupuncture and otherwise, but is it just placebo? No, it's not. We know this because when we cut off afferent nerves that are going to the nervous system, signals that are being sent to the central nervous system, the signal is lost, the benefit is lost. When you cut off the efferent pathways from the central nervous system to the periphery or motor nerves, the effect is retained, so. Now, there are numerous biochemical and neurological mechanisms for acupuncture, and various release of neurotransmitters and modulation of chemicals. This is why we cannot distill chi down to one singular thing. There are multiple things going on, so. And one of the features with acupuncture, anatomically speaking, is that those acupuncture points, which there are several, over 300 acupuncture points, what's unique about them, it has been found that they have a higher concentration of nerves at those sites. We call them neurovascular bundles. And you can get increasing sensitivity or needle sensation depending on how kind of much you bullseye that area, that kind of node, let's just call it, so which this kind of illustrates. Also, those channels or those meridians that they're called, or we call them networks as well sometimes, those are related to connective tissue pathways or fascial planes. So on the left side here, or actually let's start with the middle here, you have what we call the UB channel in Chinese medicine or acupuncture. That's the UB channel. On the left side is a simplified version of that channel in a straight line of pull. On the right side is actually that channel resected, intact, as a single continuous network there. So you have these anatomical correlations to what the Chinese were identifying as acupuncture points and acupuncture channels. So connective tissue, as I kind of mentioned on the far right, that's part of it, uh, was one of these structures that had been overlooked for many years. It's kind of the thing that people cut through to kind of get to the good stuff, right? So, if you ever, cut chicken, you have these kind of sheaths you may have noticed as you, cut through, say, chicken breast or, now this is not an inert structure. What we find later on is that it's ubiquitous throughout the whole body. It permeates every element of it. If you got rid of all your muscles, all your organs, all your bones, your body will still retain most of its shape because of connective tissue. That's how much it permeates the entire body and is involved with fluid physiology, nerve conduction, nutrition. So it's not this inert structure. And I mentioned this because that's what's partly engaged with acupuncture. When you put a needle into the body and there's a slight manipulation of it, you engage that connective tissue. So you can see on the left side, a little bit of rotation of the needle, how much that tissue winds and kind of binds around that needle. And that initiates a cascade, a reaction that has some therapeutic benefit. As I mentioned earlier, those acupuncture points, they have a high concentration of nerves and vessels at them. We call them neurovascular bundles, as I mentioned, but they also have a high concentration of ATP. So what happens when you stick a needle into an acupuncture point, it helps release some of that ATP and create some communication to the central nervous system. Now, what kind of tries to tie this all together and explain why acupuncture has this interestingly wide spectrum of effect. Why does it help with pain? Why does it help with neuropathy? Why does it help with, vasomotor symptoms like hot flashes or irregular menstruation? It has this interestingly diverse spectrum that seem almost unrelated. And it's not to say that acupuncture is a panacea or cure-all. It is not. But what gives idea as to why acupuncture works is through pure energetic signaling. So as I kind of mentioned, when you puncture that point, the ATP is released, it sends signals to the brain stem, and that helps control and modulate various functions in the body related to the gut, to the lung, to the heart, reproduction, and also helps inhibit pain. If you want to look at it in a simple way, it's almost like a reset or recalibration through the nervous system. And when things are in a more balanced state, things fall into place with respect to health as well. Again, going back to that cluster symptom management, why we can treat one thing, but also help other things as well. So it's primarily through this neuromodulation with the acupuncture needle. Now, more specific to neuropathy, there is some, this is done by Dr. Lou at Dana-Farber, this review here. With respect to neuropathy, preclinical studies have suggested that it helps regenerate nerve fibers via modulation of nerve growth factor and neurotropin-3, suppressing overexpression of TRPV1. This is a pain cascade, so this seems to be suppressing that as well and inhibiting other inflammatory pathways. We know that inflammation can contribute to many conditions and exacerbate many symptoms as well. So that's a little bit more specific to neuropathy. There needs to be more research with respect to this, but these are some early suggestions as to how it may work with respect to that. Now, logistics, kind of just getting down to brass tacks about acupuncture. What credentials matter? A lot of patients come in to see me and they're asking kind of, oh, so how did you get into this? What kind of training did you have with this? I might be dating myself, but I think back in the 90s, there were these infomercials that were on late at night with actress Sally Struthers and asking, do you want to make more money? Here are some remote courses. This is pre-internet days. You would order these cassettes to do these kind of training and certifications. And I have some patients humorously kind of ask me, in a kind of a oblique way, thinking that I went through like a weekend course to get acupuncture training. We're actually very well-trained providers, and I want to reassure you that whether you go to an acupuncturist or a medical doctor trained in acupuncture, you're going to get some properly trained acupuncturist that's going to give you the treatment safely. So in order to become an acupuncturist, you need a minimum of a master's degree. So this is accredited by the Accreditation Commission for Acupuncture and Herbal Medicine, recognized by the Department of Education. So you need a minimum master's. Once you obtain that, you can sit for board examinations and apply for licensure in your respective state. There are doctoral degrees. There are transitional doctoral degrees where people with a master's can take some online classes to transition to a doctorate. There are also first professional. There's an effort to eventually phase out the master's and make it like an entry-level doctorate, like you would see, say, in dentistry or chiropractic or those kind of professions. The highest degree or terminal degree is the DAOM. So this goes beyond the aforementioned, and that also entails specialization and research, in addition to clinical rounds and such. So, like for instance, my specialization is in oncology. Other DAOM programs may specialize in women's health and fertility and so on. The other avenue to get licensing. Oh, I should mention these are the accrediting boards, or for the NCCOM gives board examinations for all states but California. California has their own. And then you want to look for somebody that's licensed or registered in their state. So these are the credentials for that. You also can get training, or I'm sorry, find an acupuncturist, a physician acupuncturist. So there are programs that are designed for MDs and DOs. Here's one in the United States on the left, the American Academy of Medical Acupuncture. And the one on the right is a program in Canada, McMaster's University. This requires training beyond the conventional medical school training. For instance, the AAMA on the left there, medical doctors or DOs have to do an additional 300 hours of training, and I believe publish and take an examination to get the credential for the acupuncture. So you have the kind of conventional acupuncturist or traditional acupuncturist, and you also can see an acupuncturist that has a MD or DO background as well. So those are two safe pathways to find an acupuncturist. In terms of other logistics, cautions and contraindications. Some of these are pretty obvious. Refusal, I'll point to number 1.3 and 1.4. This may vary from institution to institution. These are on the low end. I can say from my experience, it's been over 14 years, people on blood thinners have not really been an issue. Even low ANCs, I've never had a patient have an infection from acupuncture. We have clean needle technique practices that we employ and apply to our patients. So some places may have added 1,000 for the ANCs. This is on the low end, 500, never been a problem. So very safely applied. Electroacupuncture, which I will demonstrate a little bit later. For patients with a pacemaker or defibrillator, it is cautioned or contraindicated, depending on the region. Needling avoidant to, of course, obvious, the tumors, ulcerations. 3.2 and 3.3, I want to draw your attention to. This is more applicable in the cases of, say, breast cancer patients that have had a mastectomy or a lumpectomy. They can develop lymphedema, swelling of the limb, for instance. Generally speaking, it is frowned upon or contraindicated to needle those limbs, whether it's a blood draw or an IV or even taking a blood pressure. Acupuncture is an exception, actually. There has been some research to show acupuncture can be applied safely in those areas. It has even been used to try to treat it, but really the data is not that compelling as far as the benefits for acupuncture for lymphedema, but it can be safely applied. And I mention this because if I have a patient that has lymphedema, but also has neuropathy in that side, I can safely needle that limb. That's okay. So I want to clarify that. Other contraindications and cautions, pregnancy. There are certain points and regions that are to be avoided during pregnancy. Epilepsy, of course, because of involuntary movements, that could potentially happen. And then 4.4 also reiterates that, but that's for other conditions such as Huntington's disease, can have involuntary movements. And then 4.5, very emaciated patients, they're more prone to organ puncture or nerve puncture, so there can be some damage there if not applied correctly. So, okay, adverse events. What can happen in terms of acupuncture? As I mentioned, and will reiterate, acupuncture is very, very safely applied when done by a properly trained provider. Most common reactions or adverse events from acupuncture are going to be things like bruising, which is to be expected. You have many sharp objects being poked into you. A little bit of bleeding, sometimes a little lightheadedness, especially if the patient is being treated face down. So other ones that are may occur. Not common, but sometimes fainting can happen. Uh, like I mentioned, infection, very, very rare. Sometimes it can be an exacerbation or aggravation of symptoms. So, in the acute sense, acupuncture is slightly pro-inflammatory, because you are puncturing the body, and that's going to induce an anti-inflammatory cascade. So, in some cases, that can linger on a little bit longer than expected. So, some patients may have, more intense pain for a day or a few hours. This is not common, but it does happen once in a while. So, some patients may experience an emotional release. They may just start crying spontaneously for an unknown reason. I have many patients express, or in the past, that say I'm, kind of bawling, and I don't know why, but they find it cathartic and they find some relief from that. But again, the most common bruising, a little bit of bleeding, sometimes some lightheadedness. These other ones are more due to negligence by the acupuncture, or due to poor technique or poor training. So. There are two main structures when it comes to acupuncture. You have the community style and you have the individual style. The individual is kind of the standard. That is the private one-on-one treatment structure. The community is useful, especially because of its cost effectiveness. The only problem is that you are limited to the front of the body, and you don't have as much access to ancillary tools like electrical stimulation. So this is oftentimes, done in a room, maybe with 4 or 5 other people. You're sitting in reclining chairs, and the acupuncturist can quickly go around and treat several patients at one time. So it may be appropriate for some situations, but you have much more flexibility with the individual acupuncture or one-on-one treatment structure. So that's going to be the most common. Now, in terms of cost, this is kind of what we charge at Henry Ford to give you an idea. This is pretty comparable to what you'll find in other institutions or even private clinics. Of course, it will fluctuate a little bit, but for instance, we charge 144 for an initial and 94 for a follow-up. Many places offer packages. Some places, for instance, or private clinics may offer a sliding scale depending on income. And there are also community flat rates that you see there. So this is our example, not too dissimilar from what you might find in the private sector or other systems. Now, does insurance cover acupuncture? The short answer is usually not, unfortunately. In some other parts of the country, like California, it does. In most parts of the country, it does not. But there are avenues of coverage for different circumstances. It may not be so relevant to you guys in terms of as cancer patients and survivors, but um, there is coverage for PIP claims, workers' comp. If you have a flex savings or health savings accounts, it usually covers acupuncture. So that is one other avenue for coverage. If you are a veteran, there is a program that helps cover acupuncture as well. Believe it or not, acupuncture is very popular in the military and VA, and they actually staff their own acupuncturists or people that have obtained acupuncture certification. If they do not have it in-house, you have an opportunity as a veteran to go outside of the system to get acupuncture treatment. So if that is the case, that's at your disposal as well. Medicare just started to cover for low back pain. We're hoping that this will kind of grow into other ailments as well. So the only caveat is that right now, acupuncture, while it's covered for low back pain, acupuncturists are not recognized providers quite yet. So it requires some oversight, say, from a physician in order to sign off on that and have the coverage. But we're hoping to get that recognition or inclusion as providers into the system, and then that will hopefully open the doors up to coverage of more conditions. Also, the last option, philanthropy. For instance, here at Henry Ford, we have a program called Game on Cancer, which covers acupuncture for 10 visits for our oncology patients. There are other institutions that may have something similar as well. So if something you're interested in as far as acupuncture, these are ways to kind of explore it. But unfortunately, as I kind of mentioned, most insurances do not cover acupuncture. Now, frequency of acupuncture, it depends, of course, like anything else. But on average, in most of the literature that you see will show either once or twice a week, usually for a course of 8 to 12 treatments is very, very common. And it depends, of course, on the situation, maybe more aggressive in the beginning, maybe, 2 to 3 times a week, maybe, or and then the course for things like neuropathy, much, much longer, right? I would say 12 is on the lower side as far as, number of treatments. You're talking about maybe approaching closer to 16, 18, 20 treatments as far as acupuncture for neuropathy because of the nature of the course of the recovery and how long it takes, So some resources that you guys can go online for and you might find helpful. The Acupuncture Now Foundation, this is a group or a association established by Matthew Bauer. He's a big advocate for acupuncture and acupuncturist himself. He's trying to increase the awareness of acupuncture and disseminate some really good information, evidence-based information about it. The American Society of Acupuncturists. This is the National Association for Acupuncture. They have a number of resources on there too, so you can download various documents giving summaries about acupuncture that you can pass along to patients or to even providers. They, give you updates in terms of legislative issues, Medicare, for instance, and also various, seminars and such as well. Evidence-based acupuncture. This has a number of evidence-based summaries that you can download for free. So things for pain, for cancer-related side effects, so they can get a nice concise summary that you can have for yourself or pass along to your physician if they don't know much about acupuncture or what it can be helpful for. So that's all at your disposal on that website. The National Certification for Acupuncture and Oriental Medicine. I mentioned this earlier. If you are looking for an acupuncturist, well, I'm based in Michigan, but if we're looking outside of Michigan, for instance, as a Michigander, you can go to this database here. They have a find an acupuncturist. So somebody you'll find from this database is going to be properly credentialed. So they will either be credentialed in acupuncture or acupuncture plus herbal medicine as well. So they have a zip code you can plug in. You can find somebody in your region or for somebody else that you may be looking for. The California board, if you're looking for somebody in California, you have to use their particular database. California has to do everything on their own, right? So, so they have their own search function as well. Now, some documentaries, not necessarily relevant to, pancreatic cancer, but interesting nonetheless. The first one's called 9,000 Needles. This kind of chronicles the recovery of a former bodybuilder that suffered a massive stroke. He went through conventional route for treatment, pretty much hit a wall, and then his brother decided we're going to see what we can do and went to China. And it follows their process in terms of using acupuncture for stroke recovery. It's a very wonderful, touching story. The middle one, getting to the point, is part of the Acupuncture Now Foundation's resources. It follows acupuncture use in Children's Hospital. And then on the right is what I mentioned also earlier with Matula Shakur, is the utilization of acupuncture in the rehab drug detox setting. So those are some interesting documentaries that you guys might find. Okay, so that will conclude the presentation. And so that's the tell part, and we're going to go into the show part. So I'm going to go into demonstration here, just to alleviate any kind of apprehensions patients may have or curiosities. I'm going to show you guys the tools of the trade here first. Number one, we have this plastic sleeve or a guide tube. So this helps guide the needle in because the needles are very, very thin. And here we have the acupuncture needle itself. So you can see roughly about 1/4 millimeter thick. They will vary in length. They will vary from as small as a 1/2 inch length up to 5 or 6 inches. The latter is more for football players with hip pain. For most patients, we're not going to use a 5 or 6 inch needle. Average size 1 to 1.5. They do not go in all the way. There's always some space left on it for safety purposes and for the inclusion of electrical acupuncture. So the way it works is that we have this guide tube that loads a needle. And then when it's loaded, there's a little bit of the handle protruding there. So that gives us a space to puncture the needle into the skin. So with that being said, I will get myself ready. I'll use myself as the dummy here. I'll quickly swab the area. Okay. So needle already loaded into the plastic guide tube there. So I'm going to use a couple of very commonly used points for neuropathy. Here's one in the webbing of the hand between the forefinger and the thumb. That's close to the radial nerve. See, I tap the needle in, standing erect. I will insert it. And then I'm going to put one here down the chain of the arm. little bit hard to do this on my own, but we'll make it work. So okay, so I have 2 points inserted. I have one here, one down here close to the elbow. Traditionally, what I would do is manipulate this by hand. That's kind of the old way, and people still do it that way in the absence of electrical stimulation. But we have the luxury of technology. So we're going to use this electrical acupuncture unit, an EA or an E-stim unit. You guys can see that. Not very clear picture. There we go. This is an E-total. So what this essentially does, if you want to make this analogous to medication, is it ramps up the dosage of the acupuncture. Also, there are various settings that can be used that will induce the release of different chemicals in the body. Some more conducive, say, to pain relief, some more conducive to nerve regeneration, some more anti-inflammatory, and so on. So in the olden days, there would be various techniques described, such as on the rotation or the thrust, for instance, that will elicit different responses. Now we can do that with electricity. So I will attach the needles like so. Some of my patients call these jumper cables humorously. Okay, so again, you see a clip here and a clip there. So I want to turn on the unit, and what you will see is some muscle twitching, okay? Now, depending on the area being needled and where the stimulation is applied, the response may not be always the same. Smaller muscles may not have as much of a reaction as, say, bigger ones. But you should see something pretty substantial here. So we're going to look over here by the hand. You'll see the finger twitch pretty soon. So you can see my forefinger twitching on its own there. And then as we go over to the arm here, you'll see some twitching there in the forearm as well. Okay. Now, generally speaking, average acupuncture appointment length is about 30 minutes for the retention time. It will vary from as little as 20 minutes, 15, 20 minutes up to 45 minutes. The average time is about half hour. During needling, what the patient will feel is first that pressure from the plastic guide tube I showed you earlier. This one here. You feel a little pinch as the needle goes in, and a little bit more pressure as the needle advances. But the patient may also feel other sensations, and they are normal. They are not like what you would experience, say, from an IV or a blood draw. What the patient may feel is maybe some tingling sensation. They may feel some dull aching sensation. They may feel some kind of heaviness or pressure. They may feel something moving. What I mean by that is if I put a needle here, for instance, you may feel something kind of trickle down the arm, or a muscle twitch like you saw with the electrical stimulation. These are all normal responses to the acupuncture stimulus. And these are transient. They often just kind of come and go. Once the needles are in, patient rests for about a half hour. They may also feel some of those sensations come and go while they're laying there with the needles in, and that's normal too. So after a half hour, needles come out, treatment is done. Patients may experience what I call an echo or phantom sensation of needles still being there, and that will go away. They may experience some kind of residual aching or soreness in some spots, kind of akin to what you may experience, after working in the yard or a workout, kind of a local sensation like that. That will go away too. And these are all normal sensations to experience and are associated with the therapeutic effect. We call that the chi, or obtainment of the chi in acupuncture lingo. So that's the acupuncture procedure. So like I said, very safely applied and when done by a properly trained person. And very well tolerated, even by patients that have a fear of needles. So, all right. And that will conclude the presentation. Thank you guys very much. It's fun and enjoyable.